I'm Sue Dyson, and in this session we're going to be discussing the use of the Ridden Horse pain ethogram. In part one, I'm going to be focusing on the development of the ethogram and what it actually comprises. An ethogram is a series of behaviours, each of which have specific definitions. So with respect to the photograph on the right and the Ridden Horse pain ethogram, this horse shows its ears being back behind a vertical position for a duration of 5 seconds or more. An intense stare, otherwise known as a glazed expression, for 5 seconds or more. The front of the head is behind a vertical position, 10 degrees or more, for 10 seconds or more. We can simplify the term ethogram effectively to a performance checklist for communication with clients. So why was the Ridden Horse pain ethogram developed? I was intensely frustrated that owners were slow at recognizing that their horses had pain-related problems. Everything else would be blamed other than giving some thought that there may be underlying discomfort that was causing horses to behave suboptimally, not doing effectively what the rider wanted it to do. And there was always the fallback position, rather than consider cannot or will not or could not because of pain. The thought was always this was down to training or the rider, or the horse was just a naughty horse, rather than the consideration that there may be underlying pain. We know from surveys performed in Denmark, Sweden, Switzerland, and the United Kingdom that approximately 50% of the sports horse population, which is assumed by their owners to be working comfortably, actually have musculoskeletal pain. So this is a multinational problem and is effectively a welfare problem as well. Historically, I believe that little attention has been given to gait abnormalities in canter that I think we are beginning to understand frequently reflect underlying discomfort. So the types of abnormalities that I'm talking about include lack of spatial and temporal separation of the hind limbs, or abnormally wide spatial separation of the hind limbs with abnormal elevation of the forelimbs. The lack of a suspension phase in the canter, so the so-called forebeat canter. The horse being on the forehand and croup high, as we see in the photograph here. Becoming disunited or cross-cantering, or being reluctant to either establish canter or to maintain canter, breaking spontaneously repeatedly from canter to trot. Lack of recognition of pain-based behavior results in coercive and punishment-based training. And if the horse continues in work, there is the potential for deterioration of the underlying problems. There are additional implications. I think that horses that are experiencing pain do not perform optimally, and we're going to see some evidence from that later. They become less rideable, less responsive to the rider's cues. The rider's position is influenced, as is the rider's comfort. The rider may feel a jarring impulse being generated through their back. The horses become less trainable, and if the horse starts to behave potentially dangerously, such as bolting, bucking, or rearing, rider confidence may be impacted, as well as rider safety. Problems tend to be labelled as training related, rider related, or behavioural, or that is just how the horse has always gone, it's normal for him. And I believe that we have been conditioned that behaviours such as ears back, mouth opening, tail swishing are normal for horses.